Hi, everyone. So I wanted to offer a response collectively as a group to you for your discussion question on Module 2, question number 1. I'm a qualitative researcher by training, so as I was looking at all of your posts, I was looking for themes and repetitive ideas and trying to sort of compile them in a coherent way to understand what was being said, what I was seeing on the discussion board overall. And this is also my attempt to sort of quickly try to have a little bit different of a presence for you as you do the class, because I know that the course is really set up for you to work through each week module by module in a very self-directed way. But also, I want to make sure that you guys feel like there is someone that is in this journey with you and that you're not in it or doing it alone. Um, so I have some notes and papers here of how I've kept track and noted themes in all of what you guys were saying in response to the question. And the disadvantage of not having an in-person class is we could probably spend a lot of time deconstructing or even just talking about this idea around the prescription of psychotropic medications, how that impacts brain functioning, um, and then sort of the intersection of how do we consider context in all of this as well, traumatic events in all of this as well. But let me run through a few themes that I saw you guys post. I noticed that chronic stress and brain function was something that a lot of you talked about. I'm thinking about Vanessa and Brittany and Sarah, Yvette Valeriano, Tabitha, and Anna. You guys all distinctly use that language about chronic stress and brain function. And there's a lot of scientific evidence and proof that chronic stress over time does have a really shaping effect on how, even how the neural pathways in our brain are shaped and formed. And sort of connected to that, a lot of you also then talked about context and neurobiology. I'm thinking about Olivia, Livy, Jason, Stephanie, Brenda, Monica, and Roger. All of you use those words explicitly, and so those kind of connect in that neurobiology is not just something that's happening innately within each individual, but is also there's an interplay between context and how our brains are functioning, what neurotransmitters are firing, what level of hormones we have being released at what particular time. So I'm glad to see that each of you is sort of noticing and then also putting language to the fact that that's an important thing for us to be thinking about. And then there's another portion of you, and to some degree you all kind of spoke to this point, but addressing the root cause of the symptoms that the client was sort of presenting with. And I'm thinking there's a couple of you that said that specifically, Charlene, Brittany, Jason, Sarah, and Roger, that there may be a way in which medications may sort of control the symptoms for a time being, but at the heart of it, there may be a much bigger benefit to the client if we're really addressing the traumatic event, the rape. And that there oftentimes when we offer psychotropic meds for some symptoms, it may sort of exacerbate or even create some of those symptoms to occur more frequently or more intensely. And so at some point, it's probably prudent and wise of us to not just pursue a medical, when I say medical, I mean like medications, but also support a more holistic ability to heal from the event by offering counseling or therapy as well. Another thing I think that was really, really insightful and important that some of you brought up, I noticed Jason, Yvette V, Amin, and Rebecca bringing this up, that it would be really important as a counselor in our response to this client and to this event to try to understand and give some attention to the history of the symptoms. So not just take the symptoms at face value and how they're presenting right now in response to this traumatic event, but to try to also understand, are these experiences that the client was having prior to this traumatic event? And I think the importance of that is, like many of you are saying, if there is a history of some of these experiences and symptoms for the client, then maybe we could sort of justify taking a two-pronged approach of medicating and also offer counseling. Although if these are symptoms really that have just sort of begun in the face of this traumatic event, that might sort of require or encourage a different kind of response. Um, Another thing that I thought was really interesting is some of you said that the medical doctor theoretically did his job. A medical doctor is sort of trained to look at the symptoms, to know how to target those symptoms, and then oftentimes prescribe something to assuage those symptoms. So in some way, I think Stephanie, Sarah, and Brenda, you guys specifically brought this up. But on some level, the medical doctor, we could say, did their job. Um, but that also then raises another question for me, which I saw in the post as well, around ethics in collaborating or consulting with other professionals to make sure that you are offering a full response to a client. And Monica and Nancy, you talked about that specifically about doctors maybe not necessarily just making an executive decision about what this patient or client would need, but also being able to consult other helping professionals to say, is there something more we could do for this person besides psychotropic meds? For instance, is there a chance that they might also benefit from counseling? Clearly, that doesn't happen probably enough as we would hope that it does. And so someone might get lucky and go to a doctor that will offer that as an alternative, or that is also being mindful of that. And sometimes I think there's others of you who spoke to the fact that sometimes doctors have a large caseload, so they're just trying to get through it as fast as they can. And sometimes prescribing medication can be one of the easiest ways to do that. But I think it does raise interesting ethical questions and considerations. Another piece, and Amin and Jared, you guys both spoke to this in different ways, but you talked about the therapeutic relationship. And Jared, you'd mentioned that the therapeutic relationship is sort of seen as a more difficult thing, more difficult path to engage someone in order to find relief from the symptoms or whatever it is they're experiencing. And it can, I guess, can be seen as more complicated and take a longer time, be more involved. And so I would say that probably is a perspective that is within our culture, that there is a quicker, faster fix, and oftentimes that's psychotropic meds. But what I think is really interesting about that is that can sort of produce this lifetime of having to sort of troubleshoot and navigate alternative symptoms that medication then raises for people. And we get into one of those situations. I think, Anna, you talked about this in your post from the first module about you might be taking medications to relieve some symptoms, but now those are producing other symptoms like sleeplessness. So now someone is on a sleep pill. And then that creates some other physiological effect like heightened anxiety. So now someone is not only on antidepressants, sleeping pills, now they're on anti-anxiety medications. And so even if sometimes the therapeutic relationship might seem more difficult and a longer pathway to help someone relieve the symptoms that they're experiencing, there's also a perspective that we could hold to where that might in fact be something that gets around some of those other troubles that we might run into when we're prescribing medications. And I mean, you talked about how the therapeutic relationship itself also alters neurobiology and also produces sort of a biochemical effect. And I don't know if any of you are aware of the work by a guy named Daniel Siegel, but he has studied specifically how therapy and counseling, the relationship itself, can change the pathways, the neural pathways in our brains that our brains really have a lot of neuroplasticity, meaning that they can be retrained. Certain connections that were once there can sort of be reverted, or I hate to use the word adjusted, but through corrective relationship, it can actually change the brain structure and therefore how the brain functions. And so there is some proof to suggest that just as much as psychotropic medications might sort of alter some of the brain functioning, the therapeutic relationship itself also has a biochemical effect. But maybe that's not always as widely known or valued. And I think the final thing that I picked up from all of your posts is really trying to think about, what does the client think? Some of us can have a perspective that we shouldn't prescribe as much. Some of us might have a perspective that we should only have therapy or counseling that's offered to a client in the face of a traumatic event. But then there's also that piece of what does the client think about the effects of the medications? What does the client think about how this traumatic event in her life should be handled? And I think that is a really important thing because the client might only want medication. A client might want both, or a client might not want medication at all. And when going to a medical doctor to sort of receive care for those symptoms first, it can be a really challenging thing, especially when we think about the power dynamic that doctors often have, that we sort of afford a lot of expertise to them. That if a doctor is telling someone that this is what they need in order to help these symptoms go away, clients might just be like, okay, like that's just what I'm going to do because that's what's going to help me. But I think if we were to meet with that client, really spending time about what they think about the impact of the medications, because as we know, there are a lot of additional side effects that medications can have. And if this client is still experiencing benefit from it, that can be a different kind of conversation that we have with them. Although if they're experiencing their symptoms to be exacerbated, then that's obviously a kind of conversation we want to have and sort of advocate for them, maybe taking an alternative route. Anyways, thank you guys for your thoughtful posts. I am going to keep up with you as best I can, and hopefully I'll be able to post another short video soon. But congratulations for making it to this point, and best of luck as you continue forward in the course.